Okay, well, hi everyone, and thanks for so many people joining us tonight. It's absolutely brilliant, and I know you've all come with wonderful questions for our amazing Dr. Marcus Hawkins, who is all primed and ready to answer the questions about low carb. Marcus, thanks for coming along and joining us tonight, and being available to answer all these questions. So you and I met, probably a couple of years ago, I think, and then we did a podcast last year, which was great, and people can have access to. And then we thought that this would be a really good idea to share some more information. So thanks for being here. And do you want to just kick off maybe by telling us a little bit about why a doctor decided to become a low carb doctor?
Well, thank you, Sue, for inviting me. You can hear me okay?
Yep, fantastic.
Yeah, great. And thanks everybody for coming along tonight. I've been a conventional doctor for 33 years. And in that time, I was doing everything I should be doing as per guidelines. And then about three to 4 years ago, I went to dinner at a friend's place, and he served up salami, olives, cheese, and said that was what he ate most of nowadays. And it was like, well, what about your cholesterol? Well, it's never been better, he said. And then he started to tell me about the low carb way of eating, which surprised me. But I did look it up, and I watched The Magic Pill, which is probably a good way to start investigating the subject. And I was quite surprised that really there was no evidence for the low fat diet that we've been pushing for the last 50, 60 years. And started to look at, well, what was the evidence for it? And there is none. So as a result, I then got onto the dietdoctor.com and watched their videos and read their information, and started to realize that really we've been conned. And through what they were advocating and what the movies are advocating and what I was learning, you could actually see that disease was caused by low fat eating. You could also see that disease could be reversed or improved by low carb eating. And so I've become a fanatic now, and believe, totally in the idea that to improve diabetes, improve blood pressure, reverse fatty liver, lose weight, improve obviously epilepsy that might be intractable in specific centers. By doing this sort of thing, you can actually have a better life as a doctor. Life is more satisfying, actually doing some positive things. You're taking away medication, you're seeing results. People are happier because they're getting positive results. So all in all, the thing's been a huge transformation for me. But obviously you come up against the mainstream, which is 98% of medicine, and you're kind of just doing your own thing quietly in the background, but actually being happier for it. So I like to promote this as the best way forward. It's not going to suit everybody. There are those that want to follow this, those that don't, those that come and go and come back again. So yeah, I'm just on a crusade, and if people want to come along, fine. If they don't, well, that's their choice, as long as they realize it probably means medication and more medication, misery and early death, but that's another story. So that's me. I guess over to the floor for any questions.
Well, I've got a few questions coming in. So thanks for explaining that. And, I learned about low carb more than 20 years ago, and it's been an uphill battle, as you can well imagine. And in the last few years, it's got a lot more mainstream amongst the public. And I just want to say how grateful I am to people like doctors like yourself, and all the international doctors that we communicate with, that are really getting behind this message, because it's making a huge difference to the credibility of low carb. And people can see that when their doctors are promoting it, and their doctors are looking at their blood tests and saying your cholesterol is all right and your blood pressure's coming down, they feel a lot more reassured. So I really thank you for joining in that message. So I've got a few questions. So the first question is, how can it be healthy to cut out carbs from my diet? I want to lose some weight, but cutting out something as important to our bodies as carbs scares me.
Okay. First of all, I'm not giving any medical advice specific here tonight. I'm just going to talk generally. Well, that's a bullshit statement, Sue. I'm sorry to say. Carbs are not, external carbs are not required for the human body. We do not need external carbs. We make our own internally, or we obtain some from most of non-carb, most of whatever else is left that we eat. So it's fictitious to say our brains need glucose to function. It's fictitious to say that we need carbohydrates to function, external carbohydrates. There's just no scientific evidence for that. Yes, you function on carbs and sugar, glucose, but that is not what the body requires to function. It needs fat and protein, and then some carbs from some other food sources, but certainly it's not the main macronutrient that we require.
Right. Next question. Do I have to count calories?
Not at all. You do not count calories in this way of eating. What you do is you might count carbs to get an idea of how much you're taking in, so that it can guide you as to how much you might want to reduce further if things are not improving. But calories, if you eat low carb or keto, the calories, they control themselves. In other words, you eat as much as you feel you need to, and the calories actually do reduce over time by eating keto low carb, but there's no need to count calories. It's not about calories at the end of the day. It's about what you eat and the types of foods that you eat. And that's why you can eat fat and protein and lose weight, because you won't eat more than your body wants or can take in. But if you have carbs, you eat a lot more than your body needs before it realizes that it's taken too much.
And I think just spelling that calorie in, calorie out myth is really important. Yeah.
Yeah, absolutely. That is fictitious again. Calorie in, calorie out is fine if you're in a sealed ideal world where there's no energy loss anywhere else. But the energy that the energy that you take in, the energy in depends on what macronutrients you're eating. You know, so to think that energy in, energy out is actually in any way useful is wrong.
Because, you know, protein, for example, doesn't contribute to our energy intake pool. You know, it contributes to our nutrient pool, and I know it's one of those foods that will help provide glucose for us, but it's not stored the way that glucose or fat is stored. So I think, you know, when people are counting calories and they're counting their protein calories, you know, it's quite misleading, really. Yeah,
I'd agree. And the only thing you need to count is the carb content. If you are, let's say, not getting results, there's no point counting any other macronutrients, in my opinion. Fat regulates itself, protein regulates itself. You can only eat so much protein, you can only eat so much fat, and then you close off, but you can eat a lot more carbohydrate in one sitting than you actually need in terms of energy.
And my understanding is a healthy body can process about 30 grams of carbs at a time without increasing too much insulin and things like that. So that's not a lot of carbs to have at a meal. And, you know, people are eating 200 or 300 grams a day. So yeah, I think that's really important. Ketosis, there's a question here about ketosis being extremely dangerous. And I know that this is always a concern for diabetics. And I think your perspective on that would be really valuable.
Yeah, ketosis is not dangerous. Ketoacidosis is dangerous. Now, ketoacidosis is a state in type 1 diabetes. In other words, when you don't have enough insulin, where your body breaks down fat and produces massive amounts of ketones, and that makes your blood acidic, and that makes you very, very sick, and you can die. Whereas ketosis is where you are using fat for fuel. Yes, there are ketones in the blood because you're burning fat, but it never gets the same level as it does or could do in type 1 diabetes. So ketosis is not the same as ketoacidosis. Ketosis is not dangerous.
And type 2 diabetics, are they likely? They're not ever likely to get into ketoacidosis?
No, they can't. By definition. It's a different situation altogether.
Yeah.
It's really the lack of insulin means the body breaks down fat, can't do anything with it, really, or I can do it for a bit, but they're just getting more and more acidic blood and sicker and sicker. And they need insulin. That's an insulin deficiency state as opposed to an insulin excessive state, which is what type 2 diabetes is. They're quite separate things.
You would want to just comment on that just briefly, because I think that's still something that's really misunderstood in the public, certainly.
Okay, well, type 1 diabetes typically occurs in young people, but not always, mostly does. And it involves the pancreas, which normally produces insulin, stopping insulin production, usually through an autoimmune process where the body fights itself through antibodies, or sometimes other causes. And as a result, you lack insulin, you can't do anything with the sugar in your blood. So the sugar rises, and you just can't utilize it. And then you get very sick very quickly. And typically in type 1, they will often present within a matter of a few days or even a few hours, incredibly unwell, with a massively elevated sugar of 50, 60 or 80 or even higher, and need emergency treatment. Whereas in type 2 diabetes, that's a state where over time, our generation has been exposed to high volumes of carbohydrates, we've got fatter, and therefore we've become more resistant in terms of being able to deal with the blood sugar that is broken down from the carbohydrates that we eat, such that the insulin becomes more and more increased in the blood. You become more, as we call it, insulin resistant. And then you run into complications of diabetes. Similar complications in terms of the chronicity as type 1, with kidney failure, peripheral nerve failure, heart disease, strokes, and blood vessel disease. So they're quite different. The end game is high blood sugar does damage, but the type of sickness you can get with either are quite different in terms of acuteness.
Right, some more questions are coming in. A question about cholesterol. Won't high fat intake cause high cholesterol?
It may well do. The cholesterol may go up. The total cholesterol may go up. Your LDL, so-called bad cholesterol, will probably go up or stay the same. But when you look at the evidence for whether or not a high cholesterol is actually bad for you or a high bad cholesterol is actually bad for you, it doesn't stack up. What we know is if you do keto or very low carb eating, your LDL bad cholesterol goes up. Now, that goes up for the one reason that LDL is divided into two subfractions. You've got what we call large fluffy LDL and the small dense LDL. Now, if you eat low carb, the large fluffy LDL increases, therefore the total number of LDL increases. And that's actually a safe situation. If you eat low fat, then the small dense LDL goes up, and that's not a good situation. That's actually a harmful form of LDL. So you see the numbers increase, but when you look at the evidence for them necessarily being bad, it's not really there. What has happened over the last 50, 60 years is that science, or the companies promoting, say, the statin medications, which lower cholesterol, they reverse prove or try to reverse prove that their drugs work. If you look at, for example, the cholesterol levels in large population studies, quite often they won't be harmful if they're below 10. If you look at, say, the LDL, the so-called bad cholesterol, you look at a population of 150,000 people admitted to hospital with heart attacks, you'll see the LDL is a what we call a Gaussian distribution. In other words, a whole wide spectrum of levels, whereas you would expect in that situation for people with heart attacks to have a high LDL. That's not indeed true. But this whole idea is propagated by drug companies, by vested interests in drug companies, and by scientists who don't want to admit they're wrong. So the numbers may go up, but other numbers actually improve. For example, the triglycerides, which is another form of fat. If you go low carb, that will reduce, and that's actually a very good thing to have happen. Your protective cholesterol, the so-called HDL, that will increase. Again, probably a better predictor of outcome than just looking at the total cholesterol or your LDL. So there's quite a complex explanation there, but I believe the answer is that you do not do harm. Some people will have an incredibly high cholesterol, incredibly high LDL. They're a separate subgroup, and we're still trying to work out what that means. But for most people, an increase is not necessarily harmful, in my opinion.
And I'm in that subgroup of an incredibly high LDL. So, yeah. And like you say, we're still trying to figure out, but so far, so good.
But even then, sorry, just to talk about LDL, I mean, there was a study, the Framingham Heart Study, which is a big population study in the United States from the 1940s, 50s onwards. And they determined that LDL less than 7.8 was actually not harmful. So 7.8 is pretty high. But, you know, if that means something to some people, then that was determined as not being significant.
Mine's 16.9.
Oh, that's pretty high. Hyper-responder. Okay.
Yeah, I'm a hyper-responder. Yeah. Yeah. But anyway, that's a whole different topic. Not what we're talking about tonight. I did just briefly want to just touch on the big fluffy and the small dense particles, because last year I did a podcast interview with Professor Ronald Krauss, who has been responsible for helping to design some of these sub-fraction particle testing, and very, very influential in the American food guidelines. And he was very interesting. And he said, he, like everybody, believed, fat was bad and carbs were good. And his lab did some studies heading out to prove that, and they proved the opposite. And they found that the more carbohydrates that were in the diet, the more small, dense LDL. And when they removed those carbohydrates and put the fat in, exactly as you said, Marcus, the LDL numbers may have gone up, but the quality of that LDL improved. And so it wasn't the dangerous heart attack kind of LDL.
There's a paper by an American researcher called Adele Height, and she looks at what happens with various other risk factors when you go low carb or keto and compares them with low fat diets. So things like the small dense LDL, the triglycerides, the weight, the insulin, the average blood sugar, HbA1c, cholesterol profiles, they all improve with low carb as opposed to low fat. So yeah, that reiterates what you say, and the small dense LDL is part of that as well.
Certainly very fascinating. And we're just learning more all the time. Right, here's another question. Is there an impact of hormonal changes and the effectiveness of a low carb diet? We were just talking about this.
Yeah, I was talking about this with a group I regularly involve with once a month, last night, in fact. Not sure yet, but what it seems to be happening is that you'll get a woman who's going through menopause, who finds it incredibly hard to lose weight, who once you start hormone, or what we call now menopausal hormonal therapy, will then be able to lose weight. Now, I don't know how often that occurs. It occurred one of my patients recently and one of the other members' patients. But it makes sense. And so I'm actively going to be looking into that to see if there's any evidence for that. I mean, the theory would be that the body hangs onto fat cells to keep producing as much estrogen as it can, because the fat cells produce estrogen. Of course, the ovaries in menopause have shriveled and stopped producing estrogen, so the fat cells want to keep doing it. So if then you replace that estrogen with patch, then the body's not trying to make estrogen anymore. It doesn't need the fat cells anymore, and then the fat reduces. So that's a theory. All I know is there's plenty of women there in sort of middle-aged, menopausal age who find it incredibly hard to lose weight, and it's really frustrating all round, to try and help them. So yeah, watch this space, I think, really.
And then also, the adrenal glands during menopause are also one of the other producers of estrogen, but then we don't really want to have this kind of high cortisol output either with lots of stress, do we? So, it will be interesting, and you might be able to come back to us at some stage about what you find out about that.
Same with testosterone as well. Of course, males produce most testosterone, but females produce some as well. And you'll find some women who you're able to improve their lives with menopausal hormonal therapy, but they still don't have libido. They still don't have proper sex life. And again, I'm investigating this at the present time also in terms of testosterone. There seems to be some evidence that testosterone may help women as well as men, but it's not something you can readily access over here in New Zealand. It's more available in Australia, I believe. But again, I would say watch this space. I've just hit upon that in the last few months.
And I've seen a little bit of research about the connection between making sure you've got it, getting enough protein and particularly testosterone in women. So that could be, that's another avenue of research and seeing, if you're in menopause and you're struggling, maybe looking at your protein intake as well as reducing those carbs might help.
Yeah, there's sorry, go on.
Oh no, carry on.
Yep. I was going to say on Diet Doctor, there's one of their writers, Anne, I've forgotten her surname, but she writes an article on menopause and weight control, weight management in the context of low carb keto. So it might be worthwhile investigating as well.
That might be a good one to look at. Another question, how much fat should I eat each day? How much protein? Can I still be a fat burner and not be in ketosis?
Right, the answer to fat and protein is don't gorge on it. You eat until you're full and then stop. And you tend to do that the more aware you are of what you eat anyway in terms of low carb or ketogenic eating. So you'll eat fat, cheese, butter, cream, fat off meat, with protein typically in that form, and then you'll stop eating. So I don't like to put any numbers on these things. I think you just eat until you're sated, and then you eat your next meal when you're next hungry. So yeah, I don't want to get too scientific about it. I just think, if you're avoiding the carbs, that's a huge, huge step. And then you eat other stuff which is tasty. But if you eat tons of fat, just fat, you're going to get fat, put weight on. That's obvious because it has to be stored. But if you eat till you're satiated, have a nice meal, say, your fried chicken with your maybe some bacon, some cream, some mushrooms, that kind of thing with some broccoli on the side, that's a nice meal. It's tasty. And you're going to be full probably for several hours, if not longer. And the second half of the question I missed. Sorry, Sue.
So the second half was, can I still be a fat burner and not be in ketosis? And I presume this question is referring to measuring ketones, and there's different ways of measuring them, and some of them are more accurate than others. And then at the different stages that you're at in your journey will depend on how many ketones you have actually left over to be measured.
Yeah, I think the answer is probably no. I think if you're fat burning, then you're in ketosis. It's hard to be sure about that. I think if you're not in ketosis, are you actually fat burning? I think it's really a bit of a moot point, because really what you're trying to do is reduce carb intake. Now you can be low carb. You don't have to be in ketosis to achieve what you want to achieve. So you may be a healthy weight, eating low carb, and that's all fine. You've got no other comorbidities. Or you might be overweight trying to lose weight, in which case you want to be in ketosis anyway. So I'm not sure why the question is there. I think that it's about what you're trying to achieve at the end of the day.
Okay, next question. We kind of covered, is low carb diet good for people with type 2 diabetes? Let's talk about kidney problems, because that's something that comes up a lot with my clients, and they get very worried about aggravating kidney problems.
I think kidney problems, sorry. If you're going to be doing low carb, you probably very low carb, you probably should be under the supervision of someone who understands the whole concept. And it depends on the degree of kidney impairment, and depends on what else is happening in their physical lives. Say, for example, I've got a patient who's got very severe kidney impairment, but he was also overweight. And so we managed to get some weight off him by reducing his carb intake, increasing fat relative to protein more so that he wasn't causing his kidney function to be impaired. Because what happens is you break down protein. If you eat a lot of protein, that impairs your kidney function in terms of the blood tests and maybe function also, actual function. And what you don't want to be doing is actually making the creatinine, as we measure, worse. So it is individual. You've got someone who maybe has got slight kidney impairment, you can be more free rein with them. You've got someone who's got severe kidney impairment and issues with potassium or salt intake. You do have to be careful, because this way of eating does actually increase salt. Now, in kidney issues, or especially if it's severe, that is something that one has to be very cautious of with frequent blood tests, blood pressure measurements, etc. With someone who's had a kidney transplant, again, you've got to be careful, because you've got a donated kidney there, you've got other medication on board, you have to be especially careful with blood pressure control. So you kind of, again, wanting to do that cautiously, and not on your own, in my opinion, especially with the transplantation side of things and with a severe kidney impairment. I think you get into some real trouble if you're not careful, and your specialist might not be very happy with you as well. So.
Some more questions. Question: are there any side effects to cutting out carbs?
Yeah, there are. If you go strictly low carb keto, if you go straight into it, you get a headache, you get bad breath, you get constipated, you may get a rash, a few other symptoms that can occur as well. So generally speaking, I would suggest easing into it. Those symptoms, they do go away after a few days, but it's the body turning from burning carbs, fueling the brain, to fat breakdown products called ketones, fueling the brain and other tissues. The body has, it's a sudden change for the body, and it won't necessarily like it straight away. So go easy on it and gradually take down the carb intake to get to the ketosis state, if that's what you want to do. But if you go hard out straight away, then you know about it. Yeah. And other people around you know about it too.
What about constipation on low carb?
Well, generally speaking, it's only when you start, and especially if you go hard out on low carb, so try and get straight into ketosis, that's when it becomes a problem. Now, depends what you mean by constipation. A lot of people think constipation means you only go once every 2 or 3 days. Whereas actual fact, from a medical point of view, it usually means hard stool that's difficult to pass. So you do notice less crap in means less crap out with keto, right? So you eat less carbs, there's less stuff to go through. So you may only go once a day, or maybe go once every couple of days. There's nothing wrong with that. So it depends how you define constipation. But in the first part of low carb, I would recommend going slowly on it, drinking plenty of fluids, and of course you're going to get quite a bit of fiber with low carb eating. There's this myth out there that you don't get enough fiber, but just look at some of the vegetables behind me, and you eat some nuts and broccoli and cauliflower and carrots, or that sort of thing. You're going to get enough fiber, so you shouldn't actually expect a major issue. If you're worried about it, then you probably should get some Metamucil or a psyllium husk from your local chemist warehouse or pharmacy, just to sort of take alongside it to keep things going. And
I think the other contributing factor to that can be electrolyte imbalances, which happen, and that seems to be a fairly common problem.
The thing you tend to see is cramping, the muscles, and generally speaking, it's recommended that you have a bit more salt when that starts to occur. In terms of other electrolyte issues, I don't routinely do monitoring too close together. You get the baseline blood test done, and then you do blood tests maybe in a couple of weeks, but you're going to get a shift of fluid, you're going to pass more fluid in the first few days or week, you're going to maybe lose some electrolytes, but cramping would probably be the major thing I'd be talking about in that context, and I'm not aware of any sort of blood, significant derangement in blood tests.
Okay. In low carb, what is considered a carb from vegetables and fruit?
Well, basically, fruit is evil. Okay, berries are good. Fruit is nice now and again. But anything more than now and again is going to be too much carbohydrate intake and make us sick, potentially, in conjunction with other carbs that we're recommended to eat. Bear in mind, fruit has got fructose and glucose in it, and they're not good for the body. We don't need them. So fruit is out anyway, in my opinion, except as a treat. I missed the first part of the question, sorry.
I just have to go back and find it. So what is considered a carb? And then they say from vegetables and fruit. So I suppose we're talking about, is some food kind of free food that, there's some carbs that we don't worry about, and you can just eat as many as you want to from those?
What you want to avoid is densely packed carbohydrates. In other words, you've got glucose packed together as starch or carbohydrate, whatever you want to call it, and that's in the starchy vegetables and fruits. So your bananas, your oranges, apples, pears, plums, and then it's also in your potatoes and kumara. But most other vegetables are pretty minimal in terms of carb content, and you just have to go to a website like Diet Doctor, for example. It'll show you what you can eat, and really you can eat a lot of stuff without much carbohydrate intake at all. So it's really the starchy vegetables that concentrate the glucose, which is what the potatoes do and kumara does. You know, if you can avoid that and avoid the other starch sources, you know, rice, bread, and pasta, then you're on the way to reducing your carbs. But in terms of vegetables, it's really those two would be the major issue. Everything else is just about free reign.
Right.
There's a huge variety there. And just to add, people think or are told that, you know, with keto, you don't get enough nutrients or micronutrients. Well, it's wrong. I mean, Auckland AUT, Karen Zinn up there has shown that the micronutrients you get by eating keto low carb is more than adequate to maintain a normal, healthy existence. So that's a fallacy.
Will I have to give up alcohol when eating low carb?
No, depends how much you drink though. So, you know, everything has a carb value just about. And, you know, again, Diet Doctor, I don't work for Diet Doctor, but I think it's a fabulous website. And they'll give images of a glass of wine versus a glass of beer versus a cider, sherry, gin, etc. And you'll have a sort of value of how much a standard drink is worth in terms of carb content. So, you know, we still believe that, you know, a glass or two of alcohol or of wine is healthy each day. That's what we're still told. And I kind of go along with that still. But it's your total carb content in a day or value in a day that is probably more important. So you can have some wine if you know, if you're drinking half a bottle or a bottle of wine a night and you're not losing the weight that you want to lose, well, that's your answer. You've got to cut the alcohol out typically, especially if the rest of your diet is low carb or fasting.
And that circles us back to what we talked about in the beginning about calories in and calories out, and how the calories are used in your body. And there's this thing called oxidative priority. So alcohol is used preferentially over kind of the calories, if we're going to talk about calories, from everything else. And so they tend to get stored because your body doesn't need them. And your liver has to detox that alcohol because it's so toxic to us. So that's why it's used first, just for context there. Artificial sweeteners, are they allowed, and do they have effects on your long-term health?
They're allowed. I have no problem with them. I don't think anyone knows about the effects on long-term health because there's so many different types of sweeteners nowadays. No one's really studied it probably. They're just allowed into the food chain. And I think, you know, it's the lesser of two evils, perhaps. If you need to have an artificial sweetener, stevia or whatever, with your strawberries and cream, just to make it more palatable, well, I don't have a problem with that. You know, if you're losing weight or you maintain a normal weight, as opposed to be fat with diabetes, blood pressure, etc., then I'd much favor that approach than the latter, because you're going to be healthier anyway. But we don't know about the long-term effects of these sweeteners, and I do have some concern about that. But I think the end justifies the means, at least in the short to medium term.
I think there is a bit of evidence that they do still trigger some sort of insulin response, but I think in the beginning, definitely, because your taste buds will change, and after you've been doing it for a while, suddenly you won't need it because you don't need that sweet taste anymore. And they're what Dr. Robert Size calls bridging foods. You know, you need to find foods that bridge you between what you were doing and what you are going to do, that make it more tolerable to be able to, and more sustainable.
Absolutely. Yeah, absolutely.
How many grams a day is considered low carb?
Okay, well, basically it depends what you want to achieve, but if you're doing ketogenic eating, where you're trying to reverse diabetes, lose weight, reverse blood pressure, that sort of thing, looking at less than 20 grams a day. But low carb would be anywhere between 50 and 150 grams, but it does depend on what you're trying to achieve. So again, it's not about an absolute number, it's about an objective, and then trying to work towards that objective.
Do Do you think it's better to think of it as per meal rather than per day? I'm always a bit cautious about per day because it's very easy to count carbs and then have a meal that's very high in carbohydrates. So you're getting all your carbohydrates in one meal, which might really trigger that insulin response and slow down reversing the insulin resistance.
It's hard to know because I think we all have our own way of doing it. And my preferred way is just to count as I go when I'm counting, and then keep under that 20 if I can. Depends how you eat and what your philosophy of eating is, and what you're able to change. Because again, per meal it might be just one meal a day. If you're doing some fasting or you're just not hungry, you might not need to worry too much about each meal. But I think it's whatever works for the individual, probably.
Okay, let me see what else I've got here. Artificial sweeteners, alcohol. Headaches and dizziness, are they a side effect of low carb?
Sorry, yes. Sorry, headaches I left out. I knew there was something I meant to mention. Yes, you get a headache because as your brain adapts to using ketones from glucose, which has been used to for a long time, you tend to get a headache if you go straight into hard out ketosis. If you take it slowly, it's probably less likely to occur. The other thing is dizziness. Well, by dizziness, I assume you mean lightheadedness, which would imply a reduction in blood pressure. So when you first start hard out keto, you're going to lose water because that's what happens with the kidneys and the way they respond to change in the diet. And your blood pressure may fall and you may get lightheaded. So if you are someone who's on blood pressure medication or has a naturally low blood pressure, again, you wouldn't want to be going straight into ketosis, perhaps without some kind of medical supervision. And there are some caveats to this whole process. Diabetes, you wouldn't do that without medical supervision. High blood pressure is another one. So you do have to be a bit cautious. And I think, if you have other medical issues, you're better off consulting somebody who's familiar with low carb ketogenic eating for a safety perspective, especially if on something like insulin.
Yeah, I would really want to reinforce that you must consult with a doctor who's really familiar with how to lower your insulin and how to lower your blood pressure medication. That's extremely important. I'm constantly hungry and craving food between meals. What should I do?
Eat more fat. It depends what you're eating for your meals, but I mean, you're hungry because you haven't had enough to keep you full of the right stuff. So I don't know, say for example, you get up in the morning, you have you have a couple of eggs and 8 rashers of bacon. Most people would stay full for quite a few hours after that. If you don't have enough, then you don't have enough of the right stuff, then you're more likely to be hungry sooner. I mean, I usually use the example of that breakfast I just mentioned versus your bowl of cornflakes with your milk, low-fat milk, and your pile of fruit on top. You're going to be hungry again in an hour and a half, ready for morning tea. And you have your muffin and your cup of tea, and then you're hungry again at lunchtime. So it is a function, I think, of the type of food that you eat. Not so much protein, but more fat, which will last longer in the system to maintain satiety. So I think you have to look at what you're eating with those meals if it's not sustained satiety.
Mental health issues. So can low carb help with depression and anxiety and other mental health issues?
Personally, I don't know that it does. And I say that because I'm a general practitioner and I see a hell of a lot of people with anxiety and depression. I always have done. And I would say 99% of the time it's due to something bad has happened or is happening to you. And you need to address what has happened or is happening to actually resolve the depression. And we see a lot of people who go through an episode of depression, get better and move on. They may have something occur later on for their episode. But I've not actually tried this with depression. I don't know that it needs it. I think it needs a more pragmatic approach to why depression is there in the first place and addressing that issue or the issues. Sometimes with medication as well, of course.
And Dr. Georgia EADS is doing really great work using ketogenic diets for a variety of mental health issues, including, you know, schizophrenia and epilepsy, but also depression and anxiety. And I know, I've forgotten her name, Julie somebody, and she's doing a lot of amino acid therapy, which she's researching, which is proving to be quite helpful. But then to the rest of your point, you know, neurochange, like neuroplasticity, and dealing with the underlying reasons and those thoughts and triggers, as you said, is really important as well. So maybe a combination of both.
I think also, you know, mental health comes into several categories, and you know, one of the major categories is the psychosis side of things. So your schizophrenia, your hypomania, your severe chronic disorders, and there may be a huge role for that there, I've no doubt, just like there is for dementia potentially. So, but for the everyday reactive depression is what we see, or reactive anxiety, I don't know. For the people who are chronically anxious, there may well be a role. I haven't really explored that yet because they're too busy dealing with the anxiety to try and convert them into a different form of eating. You know, it's actually a big step to do that, and it's actually quite difficult when someone is constantly anxious to actually do that. So, yeah, I'd continue to watch what Georgia Eads is doing, and not ruling it out at all. But I don't have any experience in that.
Great, excellent. I know there's so much you could just, you know, you could just go down so many rabbit holes with this and the effects on health. And you know, you as a general practitioner, you've got a lot of, you know, a lot of work and problems coming to you. Okay, what about on inflammation? How does low carb affect inflammation in the body? Will it help my joints?
Again, I think there's always hope that it will, and you've got to pick your patients quite carefully, because inflammation, chronic joint discomfort, for example, say rheumatoid arthritis, you know, is set with quite often sort of psychological aspects as well in terms of chronic pain and dealing with that. So it's not the same, say, as for example with intractable epilepsy, where you can severely restrict carbs and get a result. It's not as straightforward as that. And I think I don't see enough people with chronic inflammation in a true sense, inflammatory joint disease, for example, to comment. I mean, the one person I have tried has other issues which just not going to make low carb work. So again, look, I'm not ruling it out. I just don't have any experience. And I think there probably is a good role for that, because I think that the foods that we've been told to eat over the last 60 years, and I think this is what you're talking about, is really toxic to our bodies, not just in terms of making us fat and chronically sick, but in terms of the stuff that we've been told we have to eat, the highly processed food, you know, the vegetable oils that have been converted in the factory, all that sort of thing. So I think, yeah, get rid of the crap and then see what happens. And if low carb keto can help with that process in terms of specific conditions, that would be fantastic. But I guess the jury's still out. It's hard to prove a change in small numbers of people, right? So, yeah, I'm not sure, but I would remain optimistic, certainly. And if someone came to me and said, look, I want to try this, yeah, I've got no problem with that at all.
Yeah, and if it helps, that's great. And, you know, it's hard to imagine that those processed foods and those vegetable oils, I mean, we sort of know that they cause oxidative stress and inflammatory problems. So it's hard to imagine that inflammation wouldn't reduce to some extent. It's just whether it's significant enough to resolve those other issues, I suppose. How do I measure carbs? I've seen net carbs mentioned. Is putting 20 grams of spinach on the scales okay? Is that 20 grams?
No, I mean, I use an app recommended called MyFitnessPal, which is something that is free to download on your iPhone and on the other line of phones, and that allows you to get a rough estimate of what you're taking in terms of carbohydrate and fats and proteins, but carbohydrates what we're interested in. So you'll say you may maybe scan your tin of tomatoes and you see that's, well, you actually see on the outside how many carbs in there, but you may scan some other object and get an idea of how many carbs is in there, and you can add those up over the day. There's another app which I've forgotten the name of right now, from the UK, which allows you to do the same thing. It's called Freshwell. Yeah, it's an app called Freshwell. It's free to download. Again, allows you to measure your carbs, usually over a day. So you get an idea from these apps as to how much food you got. So you might weigh your spinach, and then you'll get an idea of how many grams of carbs are in that spinach, and it's going to be pretty minimal. But you may weigh your potato and see there's a whole lot of carbs in there, but you know that already probably. So no, an app is good to help you with that.
Mm. And I think it's important to point out for all food groups. I had a question emailed to me the other day about protein. It's not the weight of the food on the scales doesn't determine the protein content or the fat content or the carb content, because they're made up of so many other things. So really good to use those apps. And someone here has just also mentioned Chronometer app as being,
yeah, that's another one. Yeah,
well. Yeah, so I think that's a great idea. Just letting everyone know we've got about 15 minutes left, so if you've got any questions, please keep posting them, or if anyone wants to jump on and share their experience as well, feels like speaking up, and share their experience about low carb, that would be great. Okay, question about intermittent fasting. Good, bad?
that was good. It's good. I mean, you know, if you eat when you're hungry, you probably do a form of intermittent fasting anyway. But more specifically, if you're trying to lose weight, then intermittent fasting is particularly useful. And there's various things you can do. You can go for 16 hours without eating. You can go for 1 day without eating. You can do whatever takes your fancy in that regard. But as a means to an end, I think it's good. I don't know if it's necessary to do that as a lifestyle thing indefinitely. Some people do, and there's no problem with that, because the body usually will tell you if it's actually needing food. And for most of the time, we're conditioned to want food based on 3 meals a day that we had most of our lives. But in actual fact, I did a 5-day fast or a year or so back, and it was a bit tricky for the first 24 hours. After that, it was pretty much straightforward. It was really a mindset, and it wasn't difficult once my body switched over to not craving the next meal to, I presume, burning fat and sustaining me through that, because I still have a bit of fat on board. So it's not like I didn't have anything to feed me. But intermittent fasting, yeah, has its uses definitely, particularly in terms of weight loss.
This is a great question. Gosh, I can remember, you know, after my brainwashing at Otago University, I used to tell my clients this all the time. Isn't it important to have breakfast every morning?
No, God, no. I mean, it's historical that the breakfast was the main meal of the day, because, you know, 60, 80 years ago, when our grandparents and great-grandparents were going out to work on the farm, they would have to have a big meal just because that's what they did, but it was fat, maybe some bread, bacon, perhaps sausages, and eggs, and it was to sustain them. But for most of us who are mainly sedentary, if you're not hungry when you get up in the morning, don't eat. Why eat? You know, what's the point of that? This habit is ingrained into us. I mean, I haven't had breakfast for years. I get a little bit hungry, peckish around mid-morning, and then I have something then. But no, there's no need to have any meals unless you're hungry. So you, as I said, you may have 1 meal a day, 2 meals a day. It really depends on what the hunger is telling you. But, you know, within the area of sort of low carb eating, not because tea time is tea time or breakfast is breakfast. That's stupid. But that's what we've been told to do. The only reason for 3 meals a day is so we can be sold food, in my opinion.
And I just want to jump in there with my experience from some of my clients, because I see a lot of people who have got digestive issues, you know, and gut issues are pretty big and common at the moment. And one of the things we know with gut issues is, especially constipation and diarrhea, can be from eating too frequently. So there's this migrating motor complex, which kind of flushes us out and keeps the food moving. And it needs, sort of roughly a 4-hour break between food input. And so, if we're doing traditionally what we've been taught, breakfast, morning tea, lunch, afternoon tea, dinner, and supper, we never give our gut a chance to work properly and for all these functions in the digestive system to work properly. So I often find just getting people to make sure they've got at least a 4-hour gap between eating can be a huge turnaround for them in terms of gut health and function. And reducing, people come with, say they've got SIBO, and you just turn around that eating window and all of a sudden, it's improved dramatically. So anyway, I just thought I'd add that in there.
And just a word about fiber as well. They often, and I mentioned this before, didn't I, about the fiber content of low carb. It is adequate, if not more than adequate, with the foods that you can eat. But the other thing is that in terms of gut health or gut function, I mean, a lot of people out there with irritable bowel syndrome, and when I say irritable bowel syndrome, I mean after excluding inflammatory bowel disease and bowel cancer and all those other conditions. If you have pure or actual inflammatory irritable bowel syndrome, then we know that if you eat low carb, because you're not eating the crap, you actually better. You do better in terms of bowel function. So that's a point of note, and that's actually something that actually is very rewarding when it works.
Mm. If we're fasting, are we slowing down our metabolism? I've been told eat small and often.
No, eat small and often is just something that is, I think, there to sell food. You should eat when you're hungry and not eat when you're not hungry. I don't know enough about that question to answer it truly in terms of metabolism. I think metabolism probably does slow down, but I don't know if it's that important to know that, to be honest.
Yeah, I mean, I think there's a lot of debate out there about how much the metabolism is slowing down, and that has a lot to do with body composition as well. And my understanding and reading is that the more overweight you are, the less affected you will be by longer term fasts. You'll tend to lose more body fat, protein, doing longer term fasts, but somebody who's really lean already may find that they may reduce some muscle mass as well as body fat, and then that can have an effect on slowing down metabolism. And then the other part of that is what you eat when you come out of your fast. And that's really important as well. And that's where the work of like Professor Lehman, Stuart Phillips, Ben Bickman, that protein must be part of that first meal, protein and then fat, because you need the fat to help assimilate and absorb the proteins. So that should be part of that first meal after a fast.
Fasting can be good for regenerating tissue. I mean, you get old cells that sort of need to go, and by fasting can actually force the body to regenerate tissue. So that's probably its benefit as well.
Yeah, there's a lot of really powerful benefits. Should I eat less dairy products and nuts?
No, I mean, dairy products, you want to avoid too much milk. Milk is actually quite high in carb content, but your butter, cheese, cream, absolutely fine. And I've got no problem with that whatsoever. Nuts are good for you, except peanuts and macadamias. Other nuts are all good. They help to fill you, especially macadamias, which are really, hang on, did I say macadamias? I meant cashew. Yeah, peanuts and cashews are not good, but macadamias are a great filler. They keep you full for a long time. Good snack, or snack when I say that, a meal that doesn't keep you full for a while. So no, nuts are fine, and fiber as well.
Do I need to supplement vitamins and minerals?
Not at all. If you have a well-constructed low-carb ketogenic diet, as I was saying before, Karen Zen from AUT in Auckland has shown that the micronutrient, in other words, your vitamins and minerals, are all adequate and acceptable with a low-carb diet. So no, you shouldn't need to do that. If you just eat carnivore the whole time or just full-time meat, that's a different issue because you might be missing out on certain things. But if you have your vegetables as allowed in low carb and your berries and your meats, then you should be fine.
I'm not losing weight. I've plateaued. What should I do?
That's a wide open question, that one. I mean, you want to be doing some blood tests to make sure your thyroid's functioning normally. You want to look at what you eat and do some carb counting to make sure you truly are sort of low carb or keto. If you're just low carb, in others not down to 20 grams a day, then you want to be getting down to 20 grams a day. If you're, as I mentioned before, a perimenopausal woman, then you may want to review the options for treatment of that, because that may be stalling your weight loss.
And also, I just want to add in there that sometimes too much added fat. So as you know, when you first switch to a low carb diet and more of a keto diet, and you're adding in the fat and the cream and you lose weight, but then your energy requirements reduce and you may not need as much energy circulating in your bloodstream. So you don't need quite as much added fat because you want to really go to your body fat and be burning your body fat for energy. And so lots of sort of fat treats and things like that can be a problem. So just go back, just reevaluate how much fat you might be adding, because I find often that is the problem. And you just need to tweak that fat intake a little bit.
We say that eating fat will make you fat. That's if you eat within the confines of satiety. But if you eat lots of fat because you think it's the right thing to do to eat lots of fat, you're probably going to, as you say, Sue, scupper your attempts. So again, evaluating the fat content of what you eat is, I think, a really good point.
And I think one of the issues I see and one of the questions I get a lot, and I think it was sort of what was being raised earlier, was about being in ketosis. So a lot of people are chasing ketosis. A lot of people are wanting, they're measuring their ketones and they're wanting to see that they're in that ketosis state. And of course, adding fat helps put you in ketosis. So people are thinking, well, if I add fat, I'm in ketosis. But what we're talking about here and what Marcus was just saying is that if you can burn your body fat, that's also going to be putting you into ketosis. So
that's what you want to happen, that you're using your body fat. You're eating fat so that you're not hungry, but you're not eating so much fat that you can't burn the fat that's on you. So the body tends to regulate it quite well, but we just need to listen to our bodies a bit and say, well, am I actually eating too much fat? So am I having, my strawberries and cream for dinner, followed by a whole pile of cheese? It's just too much. So you kind of got to, you just got to sort of auto-regulate, as it were.
All right. Well, that looks like, I think that's the last of the questions. Andrew, is there anything I've missed that I haven't addressed for anybody? And that's pretty good because we're right on our hour of time. So Marcus, have you got anything you'd like to just wind up with and finish off with, just words of encouragement? And
I think, as I say, it's important to consult with somebody who's familiar with this if you're dealing with chronic medical conditions that require medication in particular. But also want to say to anybody else, it's about making it doable and simple. You don't want to get too scientific about it, in my opinion. You just want to make it workable. So, say for example, I have a list of my favorite meals, maybe 10 meals, so that I can then look at that, at the end of the day to work out what we're going to have for dinner tonight. Without thinking about it too hard, I know that meal will have good amount of fat and protein in it, but it'll be low carb. It also will be very tasty. And so you want to make it doable. You have a list of breakfasts, you have a list of lunches and dinners. Not that you necessarily have 3 meals a day, but you may find that you do want lunch one day and you want something that you can easily access, so you're not having to think too hard and get tempted by a packet of chips. So it's about a little bit of planning, but not too much. And it's about trying to see what you're trying to achieve. In other words, you want to make sure that you are eating enough, reduce carbs to the maximum degree that you need to achieve an objective. So rather than get too scientific about it, if it's not working, then you need to review what's happening.
Fantastic. I'm getting some thank yous coming through here. And yeah, thanks. Excellent information. Thank you. Very informative and interesting. Everyone in my immediate family is type 2 diabetic, and I don't want to follow the same route. Thank you. So that's fantastic.
Well, thank you everybody for having me.
Yeah, it was a great turnout tonight. We had record number of registrations. So it's obviously a interesting topic, and everyone is certainly keen to hear what you have to say. So, and another good session. Thanks. Yeah.
Spread the word, I think. Yeah, that's another thing to say.
Yeah, and that's what you and I are here for, and I'm here to help you spread the word and put some credibility and science behind this process. So awesome. All right, thanks everybody, and we'll see you next time.